So many of you have questions about this coronavirus, and this morning an expert is here live to answer them for you. His name is Dr. Arnold Baskies, and he's the chairman of the Global Cancer Control Advisory Council of the American Cancer Society. And he also works with the top doc on the coronavirus task force, who you know is Dr. Anthony Fauci. Dr. Baskies, thank you so much for joining us this morning.
Thank you. Good to speak with you again.
So, Doc, our first question is coming from Wendy, and she writes this. I have many autoimmune diseases and take hydrochloroquine. Hard for me to pronounce that. There you go. So do I have any added protection being on that medication? She wants to know if the medication is enough.
It's a great question, and the answer is we don't know for sure. So there are about 3 studies that have been published to date about the use of hydroxychloroquine with COVID-19, and it's very clear that we have very different opinions regarding its efficacy. One of the problems that's occurred is that hydroxychloroquine is at a shortage now, and the people that need it for their underlying diseases are having trouble getting it. The bottom line is we don't know for sure. We're hoping there will be, and there's a randomized study that's been started to answer that question.
All right, so Doc, we're going to go to our next question from Jessica because we've just been flooded with all these questions, and she's writing this. I have premature twins, 6 months old. They've had a low-grade fever for a week. I'm not sure if we should risk taking them out of the house to see a doctor or if we should just stay home and quarantine. How should I know if they have contracted the virus or not?
So what we know to date is that children are not at higher risk than adults for the disease. Children can get it, however. So the best answer to that question is, what would you do under normal circumstances? You would call your pediatrician, advise them as to what's going on, and be advised also that a lot of physicians and a lot of hospitals have started telemedicine, which can be very helpful under these circumstances. But I would contact the pediatrician or the primary care provider, whoever that is, let them know what's going on, and then make a decision as to how to proceed. Rest assured, however, that children seem to have much milder symptoms than adults do at this point in time. Based on all the knowledge that we have, children can carry the virus, however.
So, yes, we have established that already, but I guess I'm wondering here, to follow up on her question, the symptoms that we're commonly seeing in children, right?
The symptoms that we see in children are a little bit of a fever, a runny nose, a sore throat, possibly some diarrhea from the runny nose. Those are the types of symptoms. They can be very protean, but in a 6-month-old, like what has been described here, it's very difficult to know for sure if the child has it. But the symptoms that children get are not the severer forms that we can see in adults.
So our first question here comes from Joe. He says they won't test mild cases. So what exactly does a mild case feel like? I feel like I have the flu and keep feeling like when I'm about to get better, I relapse a little bit. Is that typical of the coronavirus?
So there's 2 questions in there. Let me confront the first one. Cough, tiredness, and fever are the most common early symptoms. And one other one that you should be aware of. The American Academy of Otolaryngology on March 22nd stated that anosmia, or loss of sense of smell, can be a symptom of this problem. But bear in mind, it's also a symptom for other viruses and for allergies. But this has been associated with coronavirus. The other part of the question was about relapse, and I'd be a little bit concerned if he hasn't gotten better, or he or she hasn't gotten better within a week or 2 of having had the fever and feeling really bad. So I would make sure that that person keeps an eye on their temperature and is in contact with the healthcare provider. It's very important.
Okay. And now our next question comes from William. He writes this. If you've recently been sick but are better now and were to get tested for COVID-19, would it show if your illness was the coronavirus?
So the way we test for coronavirus is currently is by putting a swab up into the nostrils. It depends on how good that sample is, but we like to see the coronavirus clear within about 14 days after the illness symptoms have gone away. Getting tested afterwards at this point in time is going to be a drag on the healthcare system. So I wouldn't recommend doing that. We need all the testing that we can do for the patients that are indicated when they are sick. So I wouldn't get tested now. Later on, we may have tests actually available for antibodies to the virus itself. So that'll be another opportunity to check for that.
You know, one follow-up question on that, which is how long does the coronavirus stay in your system, excuse me. So after you're feeling better, how long?
Well, we think that it can last up to 2 weeks. Some people have actually been tested, and we found elements of the virus later than that. But for the most part, I would say it's about 2 weeks for the average person to be able to find elements of the virus deep in the nasal cavities.
And at that point, can you still spread it?
That's an answer that we don't know yet. The answer is probably not, but it's hard to spread after you've been better and when your viral load is low. At that point in time, when you're better, your viral load would be considered to be low. So is it possible that you could spread the virus later on after you've had your own reaction to it? The answer is possible, but that's not where the problem exists. The problem exists with people who are actively sick and are able to transmit the virus.
His name is Dr. Arnold Baskies. He's the chairman of the Global Cancer Control Advisory Council of the American Cancer Society, and he also worked with the top doc on the coronavirus task force, who you know as Dr. Anthony Fauci. So, Dr. Baskies, thank you again for joining us this morning. And our first question comes from Ellen, and she writes this: there are medications that you could take at the onset of the flu that lessen the severity. Do they also work on COVID-19?
The answer is no. There is no data that shows that the 4 drugs that are used for prevention and treatment of the flu will work in this disease process. You would hope that they would, but bear in mind that COVID-19 rather, is a separate group of disease, is a separate disease and from a different family of viruses than is the influenza organisms that we suffer from. There are 4 drugs that are used in the treatment of the flu: Rapivab, Xofluza, Tamiflu, and Relenza. All of those are effective and have been used and are approved by the FDA and the CDC for the flu, but they're not useful. No one's shown that they're useful for COVID-19. I wish that they were, but they're not. Bear in mind also that a lot of people think that zinc will be effective, that vitamin C will be effective. The answer is no. There's no data to support that. People are turning to herbal remedies and wiping themselves with herbal oils and things like that. There's no data to support that. But the good news is that there is a pipeline of drugs. There are literally billions of compounds that are being investigated as we speak right now. Literally billions of compounds that have the potential to work against this new virus, this new enemy that we're facing. This virus is in a family of what we call coronaviruses. There are 4 of them that cause the cold. 2 of them cause SARS and MERS, and now this one. This one started in bats. It's a completely new organism. So we really don't have a drug that will prevent it.
And just gives more credence to the statement that all the healthcare providers have been saying, which is this is not like the flu. All right, our next question right now comes from Kayla, and she's asking for more details about what to expect and watch for if a small child gets sick during this time.
So again, the children will present with similar but usually more mild symptoms from COVID-19. What are they? Lethargy, in other words, the child is difficult to arouse, a fever, a runny nose, some diarrhea, for instance, especially if they have a really runny nose. Their symptoms tend to be milder. But again, they're at the same risk that adults are. But if they get the disease, luckily, it seems to be that children have a much milder form of the disease, and we may not even know that they have it. That's the good news. But children can be exposed to it and can carry it.
All right, Doc, and final question here before we wrap up. We just made an announcement a few minutes ago that came from Dr. Fauci. He says that he expects something like 100 million to 200 million Americans to get infected with the coronavirus, and he's projecting 100 to 200,000 deaths.
Right. So when we first learned about this epidemic in the United States and pandemic worldwide, the CDC estimated a worst case scenario of about 100 million Americans being infected by the virus. That number that Dr. Fauci is quoting is based on the best data from South Korea, I think, which is that 0.68% of the people, less than 1% of the people in South Korea who developed the disease, this COVID-19, died of the disease. So if you do the math, 1% of 100 million people, you get to that number. We're hoping that we can keep it down low, and we're hoping that that number doesn't get to 100 million or 200 million people. But is it possible? The answer is yes. It's not a surprise. The CDC has estimated a worst case scenario of 100 million. It could get to be more.
Oh boy. All right. Dr. Baskies, thank you so much for speaking with us this morning. I'm sure that a lot of our viewers appreciate hearing from an expert like you. Thank you.